All right. Well, thanks, Dr. Pulitzer, for taking the time to meet with me today. So I'm going to just jump into the questions. Can you introduce yourself and tell us a little bit about your organization?
Sure. My name's Dr. Stephen Pulitzer. I'm a neuroradiologist and the Chief Medical Officer at New York City Health and Hospitals, Kings County. We are one hospital of 11 in New York City Health and Hospitals, which is one of the largest public hospital systems in the United States. We're centered in New York City. There's 11 acute care hospitals, I think 6 post-acute, and about 80 or so outpatient centers, D&Ts. We work together as a health system, and I have been in this role as the Chief Medical Officer for the last 4 years.
Oh, that's great. That's great to hear. So how did you hear about upper room germicidal ultraviolet light?
From George. George is our facilities manager here locally at the hospital. I think through his network, he somehow, when we were in the first response for COVID in March, we did not have enough HEPA filters. And so George somehow or other had heard about the UV, suggested we take a look at it. We took a look at it, thought it looked great, and the units were available. So we thought it would be a really good thing to have our staff be as safe as possible. A lot of the air, where we first put it in was one of our flex ICU spaces, which had been an old emergency department, and it had its own air control system and recirc system. So it seemed like a very logical thing to do. It was basically like a big negative pressure room, a big HEPA filter. And then from there, we just kept installing them. We've installed them actually almost in every patient room in the hospital, and like med-surg bed, adult med-surg bed, and on the peds unit, not in the NICU or those areas, but and in a lot of our non-clinical spaces as well, where we do have administrative meetings.
Wow, that's amazing. How did you become convinced, essentially, that this was a good option for your facility?
There was not a lot of data on it. I think there was something in India in a TB clinic that had a few of these, and it talked about having air circulation and making sure that the air actually circulated to the height where the UV light was.
Right.
And then we looked to see if it would work against this strain, or a COVID type virus. It seemed to be indicated or that it could possibly work. So we took the risk and just.
And so,
Yeah.
I just was going to ask, so you had mentioned you guys kind of have a very large system. Have you implemented it throughout the vast majority of your hospital system, or has it been localized to certain?
Right. So I'm actually not sure if the other hospitals have it. I could find out and get back to you.
Yeah, for sure. And so what was the commissioning process like for the installation of the lights?
It all went through our facilities manager directly from, I guess they had a contract with that company. I don't know what their previous contract was for. So normally that's a lengthy process. It got expedited, and a day after we decided to do it, they started installing. So.
Do you happen to know how much it costs?
Per unit?
Or like the entirety of the project. If not, that's totally okay. But
so I think it's a couple of $100s per unit, and we probably have somewhere between. We probably have around 1,000 units, I guess.
Yeah, that's pretty extensive. That's great. So how have people within the hospital reacted? Are there people who feel worried about it, or does it give people peace of mind? What have you seen any particular reactions from?
I lost you there for a second.
Oh, can you hear me now?
Yeah.
Okay. So the question was, so how have people within the hospital reacted? So whether it be people visiting the hospital or employees, do people generally feel worried, or does it give them peace of mind when they see the UV units, or how have people reacted?
Um, so visitors, I'm not sure really know what it is. So we've had nobody, complaints, no lawsuits, nothing, to that effect. Um, Most of the staff was unfamiliar with the technology as well, except maybe the OR staff where they've had UV lights before, and actually in some of the shipping and delivery areas where there's some UV. Um, so we did a big education program and tried to explain that this was equivalent to having a HEPA filter, and how many X amount of air exchanges per minute. I think it was like 15 or something. And we don't have access to HEPA filters, but this will give us the best protection we can right now. And I think the staff was very appreciative that we took the time to install it. Nobody said anything about a health risk. Some people asked, what are you, that's UV, what are you, crazy, and we said if positioned correctly, it's way above anybody's eyesight of, line of view or height, so
Right.
so I think most people were very appreciative of it.
That's very good to hear. That's great. Um, yeah, and so I guess sort of the last question that I have for you would be, what other like layers have you guys implemented in the hospital? So things like masking, hand washing, social distancing. I'm sure as a hospital, in an entire hospital system, you guys have a lot of measures that you've taken, but are there any things you'd like to highlight?
Um, sure. I mean, so we have we have a number of we have a number of negative pressure rooms. We've increased that number, and we've made the asthma rooms and some of the larger places where you get a lot of aerosol generating procedures and some of the ORs, we've turned them into negative pressure rooms. Um, we've increased their number of HEPA filters, portable HEPA filters, and we finished the installation of the UV across the campus in the clinical areas and some of the non-clinical, as I said. And then we just really just practice everything, face shield, mask, N95 if it's aerosol generating. Actually, most of the staff wear the N95 on the unit anyway, which I'm fine with. And we close units when we get to a certain number of COVID patients, and if it's above 50% capacity, we'll close the unit, make it COVID only, and then we can conserve on PPE. People can stay in their PPE and then go from room to room because everybody there is COVID positive. And so that actually is a huge conservation effort. It got us through on the first round. We do social distancing, we have hand washing, we monitor all of that. I don't think we do anything else really.
Yeah, that's all great to hear, and it sounds like some of that stuff is, you know, like a pretty good measure to be taking, especially in a hospital.
Mm-hmm.
And so yeah, I don't know if you have anything additional that you'd like to add to this conversation.
Yeah. So, what is your what's your take on the the product? Like, do you think it works?
For
Have you
sure.
heard it?
Yeah, so that's good to hear from you on that. Yeah, so I'm just a research assistant, so I'm not like a medical professional. Um, but so my boss, the person that is kind of overseeing this sort of advocacy push for germicidal ultraviolet light, he's a TB expert, and so he's known about germicidal ultraviolet light as a mechanism of prevention control for a really long time, and he's also pretty deep in the history of TB management because he's also a medical anthropologist. So I think he is pretty convinced by the efficacy of the product, and I have to say that I think you know from what I hear from him and other people who work in our department, it seems like a really and who work in the TB space in general, it
Mhm.
seems like a pretty effective tool. Um, and I've seen, I've read up on a few um, uh, sort of experiment. Not it's there are a few animal studies that have shown germicidal ultraviolet light to be highly effective in preventing tuberculosis in guinea pigs, which You know, obviously it's not commensurate or the exact
Right.
same, but it is interesting to see that, you know, it has the potential to be useful. And so,
Mhm.
yeah, I can only, you know, hope that this will be an effective approach for, you know, preventing COVID moving forward. I know things are, you know, about to change with vaccination and stuff, but
Mhm.
yeah,
Yeah, I think it's an interesting, thank you for that perspective. I think that, you know, beyond TB, I think getting the right air circulation and making sure there's enough air moving up in that area,
right,
um, is a great concept. And if there are other pathogens that we come across, maybe, you know, that aren't SARS, but um, that's something, you know, not a coronavirus or a different virus or whatever. I think it, in my mind, hope it could be a very useful and economic way to purify the air and at least reduce the particle count by a significant amount. So
yeah,
I'm
abs-
hoping that the science proves it. There's not a lot of, there's very, very little science, you know,
right.
published about it.
Yeah, and I feel like there's probably, you know, it's hard to establish like a gold standard. I guess you could do like comparing hospitals as like similar sizes or similar COVID burdens and saying like hospitals or, you know, offices that had UV lights were, you know, showed lower rates of COVID or something like that.
Yeah,
But, you know, I think that'll come in time, hopefully, if, you know,
yeah.
enough people are kind of implementing these types of measures. So,
Yeah, I could say incidentally that um, compared to our sister hospitals who didn't have it at that time, we had the least number of staff get COVID.
that's
And
good.
I don't know if it's just luck, coincidence, or if it
Right.
had anything to do with that, but um, if that helped, I think that was worth it.
Yeah, that's kind of an incredible, you know, anecdote, and you know, maybe there's some truth to it. So
Yeah.
that's really great.
Good. All right. Well, you know, if you need any more information, please feel free to reach out. The best way to do it is to try to reach my assistant because
Okay.
I'm not a good emailer.
No worries. Yeah, yeah, we can. I think we had spoken to set up this interview, so we can absolutely reach out.
All right.
Well, thanks so much, Dr. Pulcher. We really appreciate it.
Sure. Have a good
All
day.
right. Have a good day.
All right. Bye
All
bye.
right. Bye. Have a good weekend.